Hi, I'm Chris Annunziata. I'm an orthopedic surgeon specializing in sports medicine here at OrthoVirginia and serve as the Chief Medical Officer for the DC United Soccer Club. It's my pleasure to welcome you to our Facebook Live event here at our Arlington office in Northern Virginia. I'm especially happy to be able to talk to you without a mask. It's a little bit unusual for me nowadays, but it feels great. For those who might not know, OrthoVirginia, we're the largest multi-specialty orthopedic practice in Virginia. We have many sites in Northern Virginia, and we have a new office opening shortly, or in fact may have already opened near Marymount University. But we also have offices in and around other metropolitan areas in Virginia to include Blacksburg, which is our newer association, Lynchburg, Richmond, and Virginia Beach. I don't want to take up a lot of time talking about Ortho Virginia. If you want to learn more about us, you can go to our website at www.orthovirginia.com, which I know is kind of a mouthful, but you'll get more information there. So let's start talking about you. So today I'm going to talk about assessing injuries in youth sports. When you're a young athlete, may need to see a provider and options of treat certain injuries at home. But before we jump into these tips and your questions, let's not forget about your friends. If you have any friends or family who have young athletes at home or you think they might be interested in this topic today, please take a minute and share this live event. Just click the share button below, I believe. You'll have to excuse me. I can usually talk anyone's ear off inside my office, but this is not a forum I'm usually accustomed to, so bear with me, please. So when children are young and their bones and muscles, of course, are still developing, and it'd be hard to tell what injury just needs ice and rest and what injury needs to be evaluated by a specialist. So I started to think about this and what's the best way to talk about this broad topic. And I thought it might be best to just go by really what's the first presentation. So, namely the symptoms. What are the complaints? So, what are some complaints that are worrisome? So, obviously, the main complaints could be pain. So, of course, if this is just a little owie, it's not concerning. But if there's severe pain, then certainly that's more concerning and may represent a more significant injury. Obviously, you know your child well, and you'll know what's significant and what's not. Some other obvious symptoms would be complaints of numbness or even a lack or complete lack of sensation. And I think you would find that to be somewhat disturbing, and we would find that to be disturbing. And I think that's something that should be taken seriously. And then, of course, your child or a teammate who feels they can't move an extremity or move their body. That's obviously a very concerning. That's a very concerning symptom. And then we can sort of move over into signs or really the physical findings. So again, stating some of the obvious, if you see a deformity of a joint or a limb, that's obviously very concerning. Also, if there's significant swelling, and especially if it happens right away, will be more of a concerning finding. Now, granted, some of these injuries you may see some swelling later, but when the swelling occurs pretty rapidly, again, that's a little bit more concerning, if I may use that phrase. Again, stating the obvious, if there's any significant cut or bleeding associated with any injury, especially to an extremity, there's a very worrisome sign. It should definitely be taken seriously and something that would seek immediate attention. And of course, another obvious thing is the inability to bear weight or walk is somewhat of a concerning physical finding. So now we can, I think the next way of branching off into this broad topic is to talk about some just specific injury patterns. And they can be categorized in generally into four divisions. Sprains, and these are the injuries to the ligaments. And the ligaments, you may recall, they're connective tissue that stabilize joints. So we have major ligaments in all of our major joints, and some injuries to certain ligaments can be significant, some can be minor. So those are sprains or injuries to ligaments. And then there are strains, and those are injuries that occur to what I call the muscle tendon complex. So um, a muscle tendon complex, it really is a complex in the sense that uh, those are the structures that move limbs. So it starts at the bone, then it goes to tendon, then muscle, back to tendon, then back to the other associated bone. And you can have injury anywhere in that complex. And then there are fractures, which of course are injuries to the bones. They could be injuries to a distinct aspect of the bone, or it could be injuries around growth plates, and they'll have some bearing in regards to the significance. It really depends specifically on each bone and the location of the injury in that bone. And then there are instability events, obviously dislocations, and then you can have partial dislocations or what we call subluxations, and they can occur essentially at all major joints. So that's probably the next distinct category. So I thought maybe what we would do is go from those distinct categories and just give some case examples of those distinct categories. So I think we'll start with sprain, and obviously the most significant thing that you've heard about, you maybe have read in the paper, but then again, only old people like me read the paper. So you may have watched a video or a meme or whatever my kids tell me these things are. So you may have heard about that, or certainly heard about some of the high-level athletes, or maybe a friend or a family member or a teammate who's had this injury. So what is this? The ACL is the anterior cruciate ligament, and is one of the major stabilizing ligaments of the knee. In fact, we have a little model here. Um, if I may take apart this person's knee, what we'll see is right here, this ligament right here stabilizes the femur and the tibia. So this is unfortunately a ligament that gets injured significantly, or I should say it occurs somewhat commonly in some of the more popular sports, especially your heavy demand start-stop sports like your soccer, basketball, and even some of the jumping sports like volleyball. So the classic story is one in which there's a sudden stop and twist or a sudden change in direction associated by maybe a pop sensation or tearing sensation in the knee and pretty significant pain. Maybe even the inability to bear weight. But sometimes it's a little bit more subtle. Sometimes the athlete just feels something happened and they're not really sure what happened. May not be severe pain. They may not have felt the pop sensation, but they know something's wrong. And quite frankly, regardless of either mechanism or description, it's not something that needs to be evaluated right away. Now, sometimes if it's a severe injury and significant pain and inability to bear weight, like I mentioned earlier, you may want to seek attention that evening or maybe even to a walk-in clinic. But if it's not that severe, then obviously it's something that should be looked into, but it can be looked into in a delayed fashion. So that's the sprain topic. I figured we touched upon one of the more common ones. Strains are also very common, and a lot of times they just get passed off because it's sort of the typical tweak that our young athletes have. But as I mentioned before, strains can occur anywhere in that bone, tendon, muscle complex I mentioned before. So I thought probably the best example would be involving the quadriceps, that big muscle group along the front of the thigh. This an injury to this muscle can occur from a sudden deceleration or going to strike a ball in soccer and suddenly the athlete gets hit in the ankle. So a sudden force to a muscle that's engaged. A lot of times the athlete will feel a tearing sensation and maybe even a pop. That's the most typical description. And again, it can lead to associated immediate swelling, usually not really significant deformity, but there may be some limitation in the ability to bear weight. These injuries really typically don't require acute attention, but again, some of these symptoms and signs may be a little bit worrisome, especially if it's not really an injury in the muscle itself, but really where the tendon pulled off a piece of bone, which we do see in our young athletes. And of course, those are usually a little bit more painful, and you'll be concerned enough to have it evaluated, which is fine. But most of those can also wait, like the typical sprains that we talked about. Um, the next topic I believe we broke it into is fracture. I think a good example is probably the most common thing we'll see in our young athletes, which relates to an ankle fracture. Again, these typically occur from a sudden twist or even more commonly from a fall. The athlete will feel pain and again may even feel a pop sensation. They may have difficulty bearing weight or maybe somewhat limited. But what's really hard with the ankle is it's sometimes hard to tell if it's a sprain, which is very common, or it is a fracture. And I guess some simple ways of distinguishing the sprain typically is localized to the outside part of the ankle, and it's more minor. The athlete may have a little bit of difficulty bearing weight, but usually they know it's somewhat minor. Whereas a fracture is certainly more significant. It'll be more painful. It might have pain on both sides of the ankle and certainly without difficulty bearing weight. So again, with the sprain, as you can imagine, and we talked about before, it usually doesn't require immediate attention. It usually just requires the basic tenets of care, which is rest, ice, compression, elevation, which we can use for even the other injuries I mentioned before. Um, but if it is more significant, then obviously you may want to seek some medical attention that evening. Um, then the next category, I think we broke it up into again, was the instability event, and no better joint to talk about it than the shoulder. It's where we see most of our, I should say the finger really, but we don't count the fingers. To talk about the major joints, I think the shoulder is the best example because again, someone knows someone who's had a shoulder injury. The most common mechanism is a fall with the outstretched arm, but it could be someone throwing a ball and it's suddenly interrupted with a tackle or someone running into the athlete. And these are usually the big ones. These really hurt quite a bit. The athlete will let you know right away that something's not right, and there'll be significant deformity, and there may even be some significant inability to move the limb. So these are usually pretty obvious in regards to the severity, and you're going to know right away that something needs to be done, whether it be on the sideline with the athletic trainers, or certainly in a institution such as a hospital or a walk-in clinic. There are some more subtle injuries, however, which we call subluxations or considered partial dislocations. And again, just like when we talked about with the ACL, where there could be minor injuries where the athlete just felt something wasn't right, it's sort of the same thing with subluxation. They just know something didn't feel right. They may notice a shift in the joint. And these aren't typically severe, but they could be problematic. They may lead to some further problems later on. So it is something that does need to be evaluated, but it could be again on sort of a delayed fashion. Um, so that's a basic review of worrisome signs and symptoms, as well as some basic case examples. I guess the take-home points was, which I've reiterated a few times, is obvious things: severe pain, deformity, any cuts or lacerations or bleeding near an associated limb injury need to be taken seriously and really do warrant immediate attention. Most injuries, however, are not severe and they usually can wait and just do the basics of musculoskeletal care. Again, rest, at least rest, ice, elevation, sometimes compression, depending on where it's located. But if there's any question, obviously, certainly seek medical attention. With our organization, we have walk-in clinics, and we also have some offices that are open later in the evening. I would encourage you to check our website to see which offices are open that day and that evening. I guess that pretty much summarizes a very broad topic, so I'm very happy to take any of your questions.
Okay, awesome. So our first question is about calcaneal apophysitis. There's a young athlete, soccer player, asking if an orthopedic is the best person to manage the pain management program, or what advice would you have for that?
Yeah, it's a very common problem, and I guess you can sort of lump that into stress-related phenomena. So in our young athletes, we rarely see stress fractures, as we'll see more so in our adolescents or our young adults, where the young athletes receive stress right at the growth plates, and a very common one that usually shows itself the earliest, so our youngest athletes, is Sever's disease, or what's called calcaneal apophysitis, or inflammation of the growth plate of the calcaneus. Very common thing. Good thing is absolutely 100% not concerning. It doesn't lead to any growth disturbances. It just is problematic. It just takes a while for it to go away. It may take about a year. This is one of the few times I'll tell my parents of my athletes, where I'll say, don't worry about it. And it actually really is okay to just try to manage it. The ways of managing it are obvious. Limit the exposure, limit how much time the athlete's participating in the sport. Understand when the athlete starts to feel discomfort and maybe time to start pulling back. Good cushioned shoes, maybe even some soft inserts in the shoes. And again, this is one of the few times I'll tell my parents that it's okay if the child's having some symptoms to treat it with over-counter Advil or Tylenol, and make sure to ice down afterwards. And what can be helpful too is just do some a good dynamic warm up, just loosen up the joints before sports participation. So the good news is it's very common. It is self-limited. It will go away. It's nothing concerning, and there'll be no downstream consequences.
Okay, awesome. So now, when do you use ice versus heat?
I don't know. There's really not a good scientific answer to this. Obviously, there's an acute injury where there's an acute, like I said before, acute pop or strain that's going to lead to some inflammation. Ice is definitely the best thing immediately for at least the first 24 hours. So I would be pretty judicious with ice at the beginning. I tell people heat kind of comes later. especially with the strain patterns where you're injuring the muscle tendons. After you got through that first inflammatory cascade, so it's not so swollen and tender, and then it starts feeling tight. Heat can be a little bit more helpful at that point. So maybe, oh, I don't know, maybe beyond 3 to 5 days. So
Mhm.
ice is definitely your go-to at the beginning.
Okay. And now preseason physicals. We know in the youth they only do a preseason, but in the professional athletes they do a preseason and a postseason. Is there a reasoning behind that? What kind of things are you looking for in those events?
Yeah, I guess for our young athletes, our preseason is really to look and see if there are things that are modifiable. So if we find that there's significant imbalances in strength around certain joints that we know are going to get stressed in a certain sport. So, for example, volleyball for young women, if they're designed such that they have very loose shoulder joints, it might be very important to really work on a good strengthening program prior. Or some of our male soccer players who are very tight in their quads and hamstrings. Maybe important to recognize that. So again, we can have them really focus on a good dynamic stretch before they participate. Or someone who's had an injury in the off season, or an injury maybe a year or two prior that maybe hasn't recovered fully, or we still see some deficits that need to be worked on to prevent further injury to that previous injury, or maybe prevent other injuries that can occur, as we say, sort of downstream or upstream from that injury. So I think it's important to recognize those beforehand, and that follows suit with our professional athletes. That's really what we're looking for. We do a postseason evaluation, quite frankly, because these athletes have endured a lot during the season, and they just kind of, you know, we're grinding it out. And now at the end of the year, we want to see what they really been struggling with, and are there things that we need to address surgically? Are there things we need to address in a different way with rehabilitation in the off season to get them ready for the off season, and then ready for their next pre-participation camp?
Mhm. Awesome. So this might be our last question, unless more come through. If someone injures themselves, what is the chance of re-injury, and how do you prevent any complications from that?
That's it's a great question, and it's a hard question to answer. It's really very specific to each injury, as you can imagine. Uh, we do have we do have some decent data on certain injuries. I think a good example are hamstring injuries. The biggest problem with hamstring injuries isn't so much the hamstring injury; it's the risk of recurrence. So we do know that there are certain training regimens you can go into acutely, but also chronically. These are strengthening programs that we want people to participate in, such as what's called eccentric conditioning. So we know a certain type of rehabilitation will help prevent recurrent hamstring injuries. Another good example are ankle sprains. What's really important with ankle sprains is to really not only just get through the typical swelling and pain, it's really important to regain functional strength and sort of regain the ability to balance well. If we can go through all those phases of rehabilitation, namely get the swelling down, get the motion back, get the strength back, and get the balance back, we know we can minimize the risk of recurrence.
Mhm. Awesome. So I believe that was our last question. If we get more questions afterwards, we'll follow up with people. Anything you want to say to close, Dr. Menziata?
Well, thank you for joining us. I hope that wasn't too painful and was somewhat informative. If you have any further questions about OrthoVirginia, by all means, please go to our website. Again, it's www.orthovirginia.com. Otherwise, feel free to, I guess they could send questions to
Yep.
us and we can comment on those.
Yep.
Feel free to do so. Otherwise, I wish you all
Yep.
an enjoyable spring. Stay safe, wear your mask, be sure you wash your hands, and also make sure you're a good teammate.
Yes.
Thank you.
Wait, one question.
Oh,
sorry.
sorry.
What is the best exercise to stretch hamstrings for long-term results?
Oh boy, that's a loaded question. It's hard to say. Again, it varies on the individual. Um, Everyone knows basic static hamstring stretches. And what we're trying to focus more on now are dynamic stretches, a good dynamic warm up. So more walking lunges. Quite frankly, doing things like getting on an exercise bike to spin, going on a brisk walk. Really more of those dynamic loads and stretches that way. So static stretching, of course, is important, but dynamic stretching has become a little bit more popular, and again, definitely a good dynamic warm up before participation in any sport, especially any of the explosive sports.
Awesome. All right, that was it.
Great.
Thank you so much.